my name's Charlie. I'm one of the equine vets here at Penbode. Today we'll be walking you through what's involved in our new winter horse health check. This is Sunny, he's an 18-year-old gelding and we'll be using him for our exam today. Right, good boy. Back, good boy. So we'll start with the horse restrained on a head collar in the stable and we'll start the clinical exam. Hello, good boy. So one of the things that we'll be looking at is the horse's skin. We've got no known lumps or bumps on this horse that we need to check, but we'll have a good run over anyway. Good boy, hi. Good boy. Good lad. Good boy. Let's see your face. Good boy. Come on and we'll start our palpation at the same time, including his neck and the associated muscles. Good boy. Good lad. We'll also do the palpation of the joints and the tendons on the legs. Good boy. Very well trained horse. Good lad. Having a feel of the knees. And of the soft tissues down the back of the leg and the splint bones. Having a look at the fetlock and also the horse's feet and this horse's shod, so we will assess his shoeing at the same time. Good boy. Again, just running our hands over, having a feel and a look of the skin, having a look at the undercarriage as well. Good boy. Have a feel of his back. Good boy. Is that nice? Good boy. Having a feel of his spine. Good lad. All right, we'll now come on to the back legs. Again, having a feel of the joints. This is the stifle joint. Having a feel down to assess this horse's hock. And the soft tissue structures down the back of the leg. Good boy. Abby, do you want to just move him forward away from the wall? Good boy. Good lad. Lovely. And the leg up, we can have a further assessment of the joints, of his range of motion. Good boy. Again, a feel down the back of the leg and the soft tissue structures. And again, assessing his foot and his shoeing. Okay, shall we spin him around and have a look at the other side, Abby? Good boy. So again, having a look at the skin on this side of the neck, down his chest and his legs. Good boy. And we repeat our exam on the other side. Good boy, this one up. Good lad. Having a feel of the knee, assessing its range of motion. Again, having a feel of the soft tissue structures down the back of the leg. And assessing his shoe and his foot conformation. Good boy. Have a feel of the back on this side. Good boy. It's also a good opportunity to put our hands on this horse and do a body condition score. Good boy. Looking for areas of fat over the ribs, over the shoulder, on the horse's crest, and also over their bottom. Good lad, just stand. Do you want to just push him back one, Abby? Good. This horse does have some scars on this back leg. These are scars that we know about, they're historic, but we will assess them. Good boy. Okay, do you want to just move him forward away from his hay now, Abby? Lovely. We'll just pick up this leg. Good boy. Well done. Good boy. Have a closer examination of these scars, which are old and settled. Thank you. Good boy. Ooh. Having a feel of the soft tissues down the back of the leg and also the foot and shoeing conformation. So now we've done our orthopaedic examination, we will start with our auscultation, heart and lungs. Good boy. Good lad. Good boy. So when we listen to the heart, we can assess for both rate and rhythm, and also for any heart murmurs, so any abnormal heart sounds. His heart all sounds good. Good boy. So horses have a large lung field. They've got a large rib cage and their lungs sit underneath. So we make sure we examine their lungs at multiple points to listen to both the large airways in the middle and also the smaller airways on the outside. And his lungs all sound good. Can we spin him around, Abby? So now we'll listen to his heart and lungs on the right-hand side. Good boy. Good boy. All sounds good on that side. We also sometimes listen to their trachea. Good boy. Good boy. Good boy. And here we can assess their windpipe and their upper respiratory tract. Now we'll move on to examining the horse's eye. We use an ophthalmoscope to help us with this. This has both a lens and a light, which helps us examine the horse's internal eye structures. Good boy. We'll come and assess the eyes from afar, looking for symmetry. Good boy. That's good, lad. We'll assess the eyelids, looking for any growths. Good boy. Good boy. We'll turn our ophthalmoscope on and we'll have a look at the internal structures of the eye. Good boy. Looking at the retina and the optic disc at the back. Having a look all the way round. Good boy. Coming forward and looking at the lens, assessing especially for things like cataracts. Good boy. Then we'll look at the structures closer to the front of the eye, including the iris and the cornea, the surface of the eye. Good boy. Put this one down. Good. The last thing we'll assess is the horse's third eyelid, which is in the corner of his eye. Good boy. And this can be a site for some ocular cancers, so that's important to check. Good boy. So the next part of the examination is assessing the horse's teeth and dentition. Good boy. So we'll start by having a look at his front teeth. Good boy. He's a gelding, so he does also have canine teeth. Not all horses have these. Good boy. Next, we're going to put this gag on him. This will help us safely assess his cheek teeth. Good boy. Good boy. Gently. Good boy. Just assess that his front teeth are safely on the gag. And most horses will tolerate this really well. We can now gently open the horse's mouth. Good boy. One more. And now the horse safely has his mouth open, I can assess his back teeth. Good boy. I can feel all the way to the back teeth on the top jaw and on the bottom jaw, having a feel for sharp points. we can also look in his mouth with a head torch. Good boy, steady. And this again helps us identify any further pathology. And once that's done, we can safely remove the gag. Good boy. Well done. So now we've brought the horse outside to do the trot up. We'll stand him up, have a look at his conformation. Okay, Abby, and off and walk when you're ready. So we start by assessing the horse and walk first, preferably on a firm and level surface. Helping us gain a good idea of the horse's symmetry and way of going. Okay, Abby, same in trot when you're ready. We then progress to examining the horse in trot, both going away from us and also coming back towards us. This horse does have a known orthopaedic condition in front, and now is a good idea to assess this before winter. The other part of the examination is taking a blood sample. We will send this to the lab for a biochemistry and haematology analysis.